Thank you for joining our webinar today. My name is Anastasia Lintner. I'm Special Projects Counsel, Healthy Great Lakes for the Canadian Environmental Law Association. I'll be moderating, and I'd like to start off by acknowledging the Anishinaabe, on whose traditional territory we, the presenters here in Toronto, are hosting this webinar. Please note that the webinar presentation, but not the questions and answers, will be recorded and made publicly available. As well, we'll make the slide deck publicly available after this webinar, so you don't need to scribble everything down because there is a lot of detail on the slides. All the microphones except for our speakers are muted and will be throughout the webinar. If you're having technical difficulties, please use the chat box and send a message to the organizers and presenters, and we'll try to troubleshoot your problems. If you have questions for our speakers at any time, please type them into the chat box, and we'll get to as many as we can after the presentation. To get to the chat box, you just use the dashboard at the right-hand side of your screen. There are a number of things listed there, and one of them is chat. If you can't see a place to type in, you just click the plus sign. Before I introduce our speakers, I have 3 thank yous. First, the webinar is part of CELA's recently launched Healthy Great Lakes program, which is funded by the Charles Stewart Mott Foundation, and we thank them greatly for their support. Second, we're using GoToWebinar, which has been provided to us as a service of the Canadian Environmental Grantmakers Network. The mission of the CEGN is to strengthen the impact of philanthropy in support of a sustainable future for Canada. And finally, thanks to Victor of Wired Widget, who is giving us all our technical support. We have 3 amazing speakers today. First will be Teresa McClenahan. Teresa is currently Executive Director and Counsel for the Canadian Environmental Law Association. She's worked with CELA during the Walkerton incident and the subsequent inquiry. As well, she worked as policy advisor to Ontario's Minister of the Environment from May 2006 to November 2007, which covered the time when Ontario was responding to the lead in the drinking water issue. Following Teresa is Jim Smith. Jim is currently the chair of the Ontario Drinking Water Advisory Council. He's a professional engineer, and his career spans over 30 years with the Ontario government. He was Ontario's very first chief drinking water inspector and was the chief drinking water inspector during the time of Ontario dealing with the lead and drinking water issue. And last but definitely not least, we have Cami Mack. Cami is currently the director of Safe Drinking Water Branch and the deputy chief water inspector for the Ministry of the Environment and Climate Change in Ontario. Cami has worked over 30 years with the Ministry of the Environment and Climate Change, starting as a summer student in the Laboratory Services branch. She was involved in drafting Ontario's Safe Drinking Water Act and has been part of the Safe Drinking Water branch since 2005. And now over to you, Teresa.
Thank you, Anastasia. So I'm pleased to be part of this webinar. I'm especially pleased to have Jim and Cami joining us to bring their expertise to the table about lead in drinking water. Okay, we're having technical difficulties. There we go. So there have been many issues dealing with lead over the years. Lead in drinking water was an issue that rose in Ontario in 2007, but was already covered in the Ontario drinking water standards at the time, and we'll talk more about those events in a few minutes. But as you can see from this slide, there have been many campaigns over the years all around the Great Lakes dealing with lead in various contexts, including soil remediation, including lead in terms of the sinkers in fishing, and lead in jewelry that CELA has dealt with. So we have a long experience of dealing with lead in general, but the issues arising in respect of drinking water are quite particular to drinking water. So this webinar is going to review Ontario's approach to the issue of lead in drinking water, particularly since 2007. And this approach built on the safety net that we had collectively established in Ontario after the Walkerton drinking water crisis, and I'll describe that more in a second. But as a result of that, it enabled us to take a broad-based approach to responding to lead in Ontario's drinking water in municipalities across the province, building on what was then the brand new multi-barrier approach to protecting drinking water. The Walkerton inquiry arose when the town of Walkerton had its system contaminated with E. coli 0157H7 and Campylobacter following heavy rains in the spring of 2000. And the entire drinking water system was rapidly contaminated by what turned out to be rapid infiltration of contaminant from a contaminated herd nearby to one of the wells, getting into the drinking water system. And that particular well, it turned out, was not being, the water in the well was not being chlorinated, and elsewhere in the community, the water was not being adequately chlorinated. 7 people ended up dying as a result of the Walkerton tragedy, and thousands of people became seriously ill. Many of them continue to be ill to this day. This sent shockwaves across Ontario, Canada, and the rest of the world that such an event could happen with treated municipal drinking water. So Justice O'Connor was asked to lead an inquiry and provide recommendations about how to make sure such an event could never happen again in Ontario. At the same time, in North Battleford, Saskatchewan, they were responding to a similar event, and they also ran an inquiry, and they too came up with similar recommendations as a result of their inquiry, and in fact as a result of exchanging information between the two inquiries. And the primary conclusion was that we have to have multiple barriers in place to prevent contaminants in the water from reaching consumers. We can't take our drinking water for granted, which is unfortunately what had happened over the century since drinking water was first on the radar for public health units. We also found that we have to adopt a cautious approach to making decisions around drinking water safety. We need systemic approaches for management and operating so that there are good checks and balances, and we need effective regulation and oversight. So in Justice O'Connor's 121 recommendations, he outlined various roles and responsibilities, including the provincial role to oversee a safe drinking water system. So that was implemented over a number of years, from 2010 to 2007 and beyond. And the Ministry of the Environment did move forward with developing and implementing that comprehensive approach to protecting drinking water. That included some redundancies in terms of accountabilities and responsibilities, and also ensuring there was a lead ministry, because at the time, oddly enough, there was no clear accountability for drinking water. The best there was that in the Health Protection and Promotion Act, there was one provision for a declaration of potability by the medical officer of health, and that was the only legal accountability provision prior to the Walkerton tragedy. So we proceeded to develop a source-to-tap policy framework with many barriers, which I'll describe in the next slide, as well as mandatory standards and mandatory compliance and enforcement as opposed to voluntary. So the source-to-tap approach, as is implied, means that you pay attention to what you're putting in water in the first place. You pay attention to how well the treatment plant is treating that water, or whatever treatment system you have. You pay attention to where you're storing and distributing your water, monitoring and making sure that if there are any issues, you're responding to those appropriately. And you're paying attention to what's happening at the consumer's tap so that there's safe water at the end of the day. And then if there are adverse events, you have proper responses like boil water advisories or drinking water advisories. You have reporting to the Ministry of the Environment and the Ministry of Health of any adverse events. And you have a systemic approach to making sure you respond quickly and don't have consumers drinking unsafe water. So this is what we have had in Ontario now for the last decade, but the whole system was tested very early on when we unexpectedly stumbled on the issue of lead in drinking water in Ontario. So the current framework includes the standards that are binding the Office of the Chief Drinking Water Inspector, which was a new position established as the Walkerton recommendation, the establishment of the Ontario Drinking Water Advisory Council, and then sampling requirements and regulation and much else that we don't have time to get into today, like certification of laboratories, training and certification of water operators, and so on. So I'm going to turn it over to Jim now, and he's going to talk about the events that arose in 2007.
So good afternoon. So April 20th, 2007, just to give you some context, as Teresa said, I was the Chief Drinking Water Inspector and the Assistant Deputy Minister of a division of about 300 people that was established in 2003. We were moving forward on our source-to-tap safety net, and we were confronted with this article in the press that you see. And it arose because the London Free Press heard about elevated lead levels in drinking water that the City of London was, they were looking at it from a research perspective, getting data in from, water at the tap. So they didn't see them as regulatory samples. And the information went into the press, and the issue came to the ministry and myself as Chief Drinking Water Inspector. And it got a lot of attention when that issue first hit. A number of cities were now reporting this information. There was concern. Now we talked about the safety net. I do want to give credit to the media, because they were a primary stakeholder in this case that notified the public and the ministry. So they deserve credit for that at that point in time. As you can on the next slide, as Chief Drinking Water Inspector, I was responsible for coming up with the actions and the plans and advising the minister. And you can imagine it received wide government attention across many ministries. And we put a plan into place with focusing the resources of our drinking water inspectors, brought in international experts, and tested water across Ontario. The issue was complicated because we didn't have a good understanding of why the lead levels were so elevated at the time. And we also offered assistance to the City of London so they could retest and make sure the data was accurate. So we undertook a province-wide sampling program. And samples at the tap were controversial from a number of perspectives. One is some fixtures that may have lead solder, or it may be a component of the brass fixture itself, the lead. So there was, the controversy was, well, is that the homeowner's responsibility or the government's responsibility? The other was that for many urban centers, water mains had already been replaced. Lead was not being detected in water in the distribution system. So there was this, this sense of safety with respect to lead at the tap. The real issues were around the corrosivity of the drinking water. When drinking water has a lower pH, lead can leach from the lead service lines and fixtures, faucets that have lead in the metal. So that was the reason. We next page here. Okay. In terms of our approach, we required testing across 36 municipalities in the province. It was command performance, very tightly controlled, and the results coming back showed that over 46% of those samples had at least, for which one sample had exceeded the ministry's standard of 10 micrograms per liter, which is still the standard today. And again, it was reaffirmed that the source of lead was not from the distribution system. You know, the water that you're getting delivered to your home before it reaches the curve has minimal lead in it. And so it was about the lead service lines and the plumbing. We, given it was a province-wide issue, I, as Chief Drinking Water Inspector, we worked with the Chief Medical Officer of Health, and we pulled together a province-wide plan for lead. I still remember it going to Queen's Park. It was televised, had all the media present, and you know, it got broad exposure. So the plan that was put in place in June of 2007 was multifaceted, and I'll get into this later, but it's about providing protection primarily to young children, 6 and under, and expecting mothers. We also developed a new regulation to protect children in schools, private schools, and day nurseries, and Cammie's going to speak to that. We also saw the need for assistance for these sensitive populations as an interim measure, and it was about providing filters to schools, and also to provide filters to low-income families with infants, young children, and again, expecting mothers, to help remove lead from the taps in their homes until municipalities could take lead reduction strategies.
Okay. Good afternoon. We're looking at the measures for protecting children, and that was the focus of the regulation. And although the reg measures in Ontario over the past 10 years have greatly reduced lead exposure in tap water, what we found over the course of that decade is that further action was needed. And we found that many of the over 11,500 public schools, private schools, and licensed child care centers are located in older buildings with lead plumbing. We found that sampling from only one tap per facility has not really provided us with the big lead picture. And there's a high variability in brass faucet fixtures containing 8% lead. But we did find that flushing pipes prior to use by children further assisted in reducing lead levels in tap water. In addition to protecting children at school, it was essential that we put measures in place to also ensure that they and pregnant women were protected from lead at home. With 99% of Ontario's population living within a municipality, we required that all small and large municipal systems undertook community lead testing, which started in December 2007. Where large municipal systems had more than 10% of the samples exceed the lead standard of 10 microgram per liter in 2 consecutive sampling rounds, or 2 of 3 sampling rounds, they were required to prepare a corrosion control plan and submit it to the ministry for review. Municipalities were also required to include the cost of lead service line replacement in their financial planning budgets. And as a result of the interactions, an excellent working relationship developed between governments, the regulated community, where expert advice and public education was shared and actually continues today. Corrosion control. Historically, municipalities have focused their municipal corrosion control strategies on protecting the integrity of infrastructure and minimizing aesthetic and operational problems. However, with an international eye on lead in drinking water, municipalities are now focusing on a deeper dive. what is happening in the pipes, and how do we minimize lead scaling and deposits. With 12 large municipalities currently on corrosion control programs, extensive innovation has resulted in successful individual and combined lead control strategies, including the addition of a corrosion inhibitor such as orthophosphate or pH adjustment, replacement of lead service lines or upgrades to water treatment plants, and extensive stakeholder collaboration with municipalities, our Ministry of Education, school boards, and outreach to encourage homeowners and schools to replace lead-based fixtures and plumbing. Amassing a large comprehensive data set over the past decade has provided us with evidence that we needed to further reduce lead exposure in Ontario drinking water. We are confident that our data is of high quality based on the fact that Ontario requires lead testing laboratories to be both accredited by a third party and licensed and inspected at least twice per year by the Ministry of the Environment and Climate Change. Our data set includes approximately 500,000 lead test results from schools, child care centers, and municipalities. We have found that 98% of samples taken for lead at schools and child care centers did meet the Ontario Drinking Water Quality Standard of 10 microgram per liter of lead. Flushing the pipes in every facility prior to consumption does work. However, it does waste water where lead is not an issue. Variability in taps and no sampling of all taps, as mentioned, and greater lead leaching from fixtures than from lead service lines. Based on our data review, the Ministry has decided to proceed with regulatory amendments to further reduce levels of lead exposure to children 6 years of age and younger and pregnant women. These reg amendments were filed December 2016, with mandatory requirements coming into force this year in July. Major changes included aligning the standard with Canadian guidelines, which Jim will speak to, requiring licensed labs to report lead data results to the Ministry within 7 days of approval. Prior, it was 28 days. Mandating the sampling of all drinking water fixtures in every school and licensed child care center, exempting washroom and science class taps. Reducing the need for facilities to flush when they can demonstrate low-level lead concentrations, allowing the use of NSF filters, and standardizing a minimum level of corrective action when a lead exceedance is reported. Under the Safe Drinking Water Act, licensed labs testing for lead must report all confirmed exceedances within 24 hours in writing to the operator of the school, the private school, or the child care center, the local medical officer of health, and the Ministry of the Environment. Once the Ministry receives an exceedance report, our water inspectors will work with the medical officer of health and the facility owner to render the problem fixture, to assess the problem fixture and render it inaccessible. In 2015-16, there were 172 flushed exceedances reported from 108 regulated facilities. Once the tap is rendered inaccessible, the authorities will then determine the best course of action for that specific facility. The option specific may be flushing the pipes until the lead concentrations are below the standard of 10 microgram per liter, or installing an NSF certified filter and performing a lead test for verification, or replacing the fixture and performing a lead test for verification. Provincial authorities are committed to protecting our vulnerable populations. We need to find and identify where these lead problems exist and how best to mitigate the risks of lead exposure. Based on U.S. medical reports, we have taken a risk-based prioritization approach with the new reg amendments and our compliance strategy. The amended regulations require that all schools with primary grade H children and child care centers begin sampling and testing of all taps starting this year with a 2020 completion date. Although the other schools may begin their sampling and testing regime this year, they will have until 2022 to complete the task, all based on the risk exposure to young children. This will provide us with a very comprehensive lead testing database and an inventory of fixtures across all of these facilities in Ontario. We will be able to identify where problematic fixtures exist, where filters are installed, and what corrective actions have been taken. Lastly, education and outreach. This is a very important component to the overall lead compliance strategy and our regulatory amendments. Numerous education outreach guidance materials relating to lead in drinking water have been made available on our ministry's website, but are now being revised. This will include form templates for school and child care center owners to maintain flushing records, sampling plan records, and a fixture inventory, and are available on our website.
So it's Jim Smith here again. So I'm going to speak to you about the Ontario Drinking Water Advisory Council, which is a component of the drinking water safety net that we spoke about. The council was a recommendation from the Walkerton Public Inquiry, and its primary mandate role is to advise the Minister of the Environment and Climate Change on drinking water standards, legislation, regulations, and issues to protect the water that Ontarians drink. The council is established through legislation, the Safe Drinking Water Act 2002, and the council became operational in 2004. A key role for the council is to ensure that the standard setting process is transparent, and it can undertake public consultations or consultations that are focused with stakeholders if necessary. The membership is specified up to 15 individuals with a broad range of expertise, as you can imagine, for drinking water, engineering, public health, microbiology, hydrogeology, utility operations. And the members were selected as experts in the various areas that support drinking water in the province, so academia, stakeholder associations such as the Ontario Water Works, municipalities, First Nations technical support, and there's also support from the Ministry and the Environment and Climate Change, Ministry of Health and Long-Term Care, Health Canada, and recently Public Health Ontario has also participated in our discussions on lead. I've provided you with the membership list here. You may be aware of some of these individuals. I'm currently the chair. The council was chaired by Jim Merritt for the first 10 years, and I'm been in place for about a year. So what I want to talk to you about is our current review on lead. So Ontario's current drinking water standard for lead is 10 micrograms per liter, and it's consistent with Health Canada's Canadian Drinking Water Guideline, which was set in 1992. So for Canada, guidelines for drinking water are set nationally through a federal, provincial, territorial committee, and then they are adopted by provinces and territories. And Ontario can also set its own drinking water standards as necessary. So for lead, Health Canada has reviewed the science, health, and treatment technology information since 1992, and they've commenced a public consultation on their proposal for a more stringent drinking water guideline of 5 micrograms per liter. So the council is reviewing that proposal and Ontario's regulatory approach and experience to date with respect to lead. So I want to just talk a little bit about the document and why the Health Canada is proposing a more stringent guideline. So one is the sources of lead. It comes from multiple sources. Air. It used to be a major component from the exhaust from gasoline until that was banned. Now it comes in the air, through air from various sources such as smelters, refineries, and foundries, but it's a small contribution today. Drinking water we've already talked about in terms of lead service lines, brass fixtures. Foods are expected to contain trace levels of lead. Health Canada regulates a number of foods, including baby formula in terms of maximum lead content. Soil is typically about historical emissions and deposition in lead, and in the province, many of those areas have been cleaned up over the last number of decades. And as Teresa mentioned, consumer products, jewelry, art supplies, toys, electronics, again, it's Health Canada regulates that. In terms of the health effects, inorganic lead compounds are classified as probably carcinogenic to humans based on experimental animals. However, that's not the main health effect, and it's not on which standards are based. The other important aspect of lead is that the health effects are related back to blood lead levels. So when you intake lead, it accumulates in the bone, and it can be measured in blood, and that is all the material you will see will relate health effects to levels in blood. The important health effects in the third bullet are reduced cognition, increased blood pressure, renal dysfunction in adults, and importantly, adverse neurodevelopmental and behavioral effects in children. So that's about IQ and also about attention deficit issues. The science at this point shows that the strongest association is between increased blood lead levels in children and reductions in intelligence quotient scores. And the science does not show that there's a threshold. As blood lead levels decrease, one is still seeing an association with IQ, and we haven't been able to find a level at which you would not expect those effects to occur. Health Canada has done comprehensive work looking at all exposures of lead, and in 2011 their State of Science report said, although blood lead levels of Canadians have declined significantly over the past 30 years, health effects are occurring below the current Canadian blood lead intervention level of 10 micrograms per deciliter, and that's micrograms per deciliter in blood. That number is an intervention level where action would be taken. For example, if a child has a blood lead level above that. Now that intervention level is under review, and it's expected to go down in terms of being more stringent. So health effects have been associated with blood lead levels as low as 1 to 2 micrograms per deciliter, and so the recommendation is that additional measures to reduce exposures of lead to Canadians is warranted. I've added the next diagram. There's a good paper, Prevention of Childhood Lead Toxicity, American Academy of Pediatrics, and it's recent, July 2016. The y-axis is about blood lead levels, but that's not really what's important here. What's important is the tremendous decline in blood lead levels of children aged 1 to 5. And you can see the various U.S. initiatives, regulatory initiatives, in terms of phase out of lead in gasoline, ban on lead in plumbing, ban on lead solder in food cans, and we see a similar reduction in Canada. So if we're looking at drinking water, we talked about lead coming from numerous sources. So one of our members on the council, Ian Douglas, pulled together an exposure chart. And what he's done is he's held basically constant the exposures that one would get for a 5-year-old from dirt, dust, food, and air. And the blue is the exposure, the intake one would expect from drinking water under various scenarios. So on the left-hand side, that is a lead service line home with no corrosion. And one would see levels up to 20 micrograms per liter or higher. That's not unexpected. And one can see the relative contribution of drinking water is significant relative to everything else. If we take a lead service line home that's meeting the current Ontario standard, you can again see that drinking water exposure is still significant relative to other sources. And the other scenarios are the exposure with the proposed guideline by Health Canada of 5 micrograms per liter. And you can see that at the far right, a new home, you would expect very, very small contribution of lead in drinking water to the daily intake for a 5-year-old. We have Canadian data. There's lots of research going on in Canada on health effects and also on exposure for lead in drinking water. And this was a study in Montreal. And what's important here is they compared groups of children aged 6 months to 2 years and found that children who lived in homes with drinking water lead concentrations above 5 micrograms per liter had a blood lead level increase of 1 microgram per deciliter in comparison to children who lived in homes with drinking water lead levels below 5. So what we're showing here is, one is drinking water can be a significant intake, that drinking water levels that we're seeing and are concerned about can increase the blood lead levels by 1 microgram per deciliter or more. So the next figure puts that into perspective. So one of the ministry senior toxicologists has provided this to council, and I'll explain it. So the background, if you're looking at children in Canada, on the right-hand side, that little diagram in blue, you would expect about 0.8 micrograms per deciliter of lead in blood, and that's sort of an average across Canada. What he's done here is looked at what is the contribution of drinking water to blood lead levels at various concentrations in drinking water. So you have a child drinking 10, which is the current standard in Ontario, child drinking 5, the proposal by Health Canada, a child drinking 1, and then Health Canada has estimated that at 0.08 to 0.008 parts per billion is a level where we would no longer be concerned for lead exposure to children. So when you look at that, when you look at the table, what you're seeing under each of those drinking water scenarios is the increase of blood lead levels from the consumption of that concentration of lead for that child. So you can see at 10 parts per billion, you would expect blood lead levels to go up 1.5 micrograms per deciliter. And the relationship to the health effects is an IQ point loss of 1 to 1.9. So a child drinking that amount of lead through drinking water, one would expect a drop of IQ in that range. And then you can see at 1 part per billion, we're starting to get to what's considered more of a de minimis IQ loss, 0.1 to 0.2 IQ points. And there's controversy around what does that mean? Is it real? Would it have an impact? And much of this is also looked at from a population perspective. If you're shifting IQs of a population, and what does that mean for that population? So Health Canada, their bottom line in their proposal is they looked at both the health effects, treatment, and analytical achievability, and they're recommending that the Canadian guideline go from 10 to 5 micrograms per liter for total lead in drinking water. And that's based on a sample of water taken at the consumer's tap and using an appropriate protocol for the type of building being sampled. And there's a lot of, there's a lot of science behind that as well, in terms of when you take samples at the tap, is it a stagnant sample? Is it after the system has been flushed? How long do you leave it? So those are other considerations. An important part of their proposal is the second bullet, which says, as this value exceeds the drinking water concentration associated with neurodevelopmental effects in children, every effort should be made to maintain lead levels in drinking water as low as reasonably possible. So the standard is being set at a level above where you still expect health effects in the population. It's important to note that. Lastly, the consultation started in January, ends March 15th. So if you wish to comment, those are the timelines. For the council itself, we're taking a comprehensive review of Health Canada's proposal and Ontario's regulatory framework. We're particularly looking at the science behind how you set a standard for non-threshold neurodevelopmental toxicants such as lead. We have science policy for carcinogens, 1 in a million lifetime cancer risk. We do not have a science policy position for a toxicant such as lead, so that's new policy. We're reviewing the as low as reasonably achievable concept in terms of what does that mean for corrosion control for municipal drinking water systems. How low can technology take us in terms of minimizing lead at the tap? Looking at lead service line replacement as part of urban infrastructure renewal. If you get rid of the lead service lines, the municipal portion and the homeowner portion, you have mitigated much of the issue. And a major area of interest is the use and benefit of end-of-the-tap filters. Filters can reduce lead to 1 part per billion or lower. And municipalities such as the City of Toronto have said households on lead service lines with expecting mothers or young children should use filters. Strong message. And lastly, looking at all of this in terms of implications for the regulatory processes that we have in place in Ontario.
Okay. So just to wrap up, and before we turn it over to questions and answers, which Anastasia will moderate for us, one of the things we wanted to leave you with is the framework that when the lead issue arose in Ontario and continues to be dealt with here, we had a drinking water safety net. The Walkerton inquiry had reinforced for us in spades that we can't take safe drinking water for granted, and we need a redundant multivariate approach. It needs to be transparent. The public has to have access to information in order to trust their system, and multiple types of oversight is essential to ensuring safe drinking water. So having a strong safety net in place enabled rapid action, as Cami and Jim have described, when the issue arose, first in London, and then it was rapidly realized that it was actually an issue in municipalities all across the province, particularly the old urban centers that had older residential construction. And as you've heard, the response was multifaceted. It involved various ministries of the Ontario government. It involved different types of dwellings, different types of supply of water, different types of responses. And it was a range of a very comprehensive regulatory approach that covered everyone from the schools and day nurseries who have children in their care to the municipalities and the utilities who are supplying water to the population. So how we would have reacted in Ontario if we didn't have that safety net already in place is a good academic question that somebody might want to examine at some point. But I think from where I sit, having been part of the response to Walkerton and then part of the response to the lead situation in Ontario, it's pretty critical that we have developed that safety net and that we continue to maintain that safety net and that we not take it for granted. And it's very, very tempting, or not even so much tempting, but maybe just human nature, that as the years recede since Walkerton, which after all was 17 years ago now, people might not feel that this is an ongoing pressing issue, but of course it does remain an ongoing pressing issue, and as long as we maintain a strong safety net, then we have ways to respond and continually improve the system, which in itself was one of the recommendations of Justice O'Connor. And what you've heard Cami and Jim discussing today is the fact that the continuous improvement approach is taken very, very seriously. There are ongoing serious issues to grapple with, and we can't imagine that because we responded to lead 10 years ago, now we can stop worrying about it today. So with that, I will turn it over to Anastasia to moderate our Q&A.
Great.